After taking the vital signs, I would then perform hand hygiene and ask a series of questions about the gastrointestinal, the urinary system, and the reproductive system. And you gain most of your knowledge through subjective data. So asking questions such as, have you had any recent abdominal pain or any problems with your abdomen or digestive system, any pain in the general area? My patient reported no stress, fatigue, nausea, no vomiting, no gas, no constipation, no diarrhea. I would then ask when their last bowel movement was, and they would have said this morning. I also would want to gather data about their family history with any issues with their reproductive, their kidneys, their bladder, their urethra, anything like that, and past surgeries, family issues in the past, if they've had any changes in their diet, if they're getting the proper amounts of nutrition, getting the proper amounts of vegetables and fruits. My patient reported all maintaining a nutritionally fit diet, exercising, rarely drinks, does not smoke, has about 2 drinks if they do drink. I would also ask if the patient had any urinary problems such as leakage of urine or any pain or burning with urination. I would ask the color of their urine and how frequent they urinate, and it's a light yellow, clearish color, about 4 to 8 times a day, just depending. And I would also ask to make sure there's no blood in the urine. And in terms of the reproductive system, my patient is female, so I'd ask them when their last period was, which was the 9th. I would also ask if they've recently got a mammogram, and then if so, when. And my patient said about a year ago, so they're about due for another. I would also ask if they're sexually active, how many partners they've had, which is 2, if they use protection. In this case, they do use a contraceptive orally. I would also ask if they've had any discharge or any unusual discharge out of the vagina, since the patient is a female. I would then continue into and inspect the skin characteristics of the abdomen. So at this point, the patient would be sort of sitting or laying down for my abdominal inspection. I would make sure the skin color, surface, contour, and surface all were smooth. The umbilicus was centrally located. Any scars or any stray, stretch marks were all just within the ranges. The contours usually sunken. The patient's not obese, so there should be no slight perfusion. And then I would auscultate the abdomen in the 4 quadrants. And I would begin, if this is my patient, I would begin at the right upper quadrant, and then I'd move over to the left upper quadrant, then down to the left lower quadrant, and then over to the right, probably about, and listening to the sounds for about a minute on each. And then I would have the patient, as the patient's laying down, I would palpate the abdomen, looking for any tenderness, and the patient doesn't have any tenderness present. All the abdominal muscles are relaxed. I'd be feeling for any masses or any aortic pulsations that I can feel. No masses or anything like that, no pulsations that were unusual. And while I'm palpating the stomach and the abdomen, I would make sure I look at the patient's face for any grimacing or for any tenderness or pain that they don't really know about. And if the patient did have any pain in the abdomen, that would be the last area of the palpation I would do. And really that's about it for the 3 systems. I would thank the patient, I would have them dressed. They would obviously, if they were in a bed, they would lay back down. I would lower the bed, put the collar back on, and thank them for their time, perform hand hygiene, document my data, leave, and that would be it.